Hello, Pharma friends. Welcome to Pharma Syndrome channel. In this session, I am going to discuss regarding drugs for the treatment of congestive heart failure. Drugs for the treatment of congestive heart failure. So here, this classification you can remember with a easy trick, that is bands VPC. So that is simply bands VPC. So here bands VPC. B means beta blockers. And first of all, congestive heart failure is nothing but the heart is unable to perform its function because of excess accumulation of fluids within the heart. So that leads to congestion, accumulation of excess fluid, and there is an enlargement of heart, and ultimately there is a chance of failure of the heart function. So for that purpose treatment, there are list of drugs are there, and starting with the trick, that is bands VPC. In bands VPC, first B means beta blockers, and with the trick, the beta blockers also CM Chandrababu Naidu, that is CM CBN. Drugs like carvedilol, metoprolol, carvedilol again, and bisoprolol, as well as nebivolol. So requirement of beta blockers in the treatment of congestive heart failure because of to prevent overactivity of heart, to prevent excess activity of heart, which is not required. And next category in the bands VPC is next letter A. A means aldosterone antagonist. So especially in the congestive heart failure condition, there is excess fluid accumulation in the heart that leads to excess fluids present in the body. So what is the role of aldosterone? Aldosterone causes sodium and water reabsorption. So increasing sodium water reabsorption may also increase the fluid accumulation in the heart. That's why we have to block aldosterone receptor. Aldosterone is a steroid, and here blocking of steroid aldosterone receptors by using drugs like spironolactone as well as eplerenone. Spironolactone can produce a drawback, and spironolactone active metabolite is a cannabinol. Active metabolite is a cannabinol. And the drawback of spironolactone is gynecomastia, abnormal enlargement of breast in the males. This is because of blocking of testosterone receptor in the males. And eplerenone is selectively blocks aldosterone receptors only, does not produce gynecomastia because it does not blocks testosterone or androgen receptors in the males. And next, in the band sequence, next is N, that is natriuretic peptides. So these are the peptides involved in the natriuresis. Natrium means sodium. Elimination of sodium in the urine is natriuresis. So number of peptides like A and P, atrial natriuretic peptide, B and P, B natriuretic peptide, C and P, C natriuretic peptide, D and P, D type of natriuretic peptide. So here, what is the main aim? To remove excess fluids present in the heart through the kidney. So here, what these peptides are doing? They are doing that they eliminating the sodium through the urine. What will happen if sodium is eliminating? Along with sodium, water also goes out. Elimination of sodium and water decrease the fluid volume and decreases congestion, accumulation of excess fluids in the heart. So, like nasal congestion, what is happening? So, if nasal congestion is there, we are unable to squeeze it. We are unable to remove the secretions from the nose. Like here also, congestion means excess accumulation of fluids in the heart. That is, heart unable to perform its function, like cardiac output. There is a no proper cardiac output because of congestive heart failure. Congestive heart failure. And next continuation, the bands VPC B beta blockers completed, A aldosterone antagonist completed, N natriuretic peptides completed, and next is the D. Next is diuretics. Diuretics is the first choice for the CHF treatment because in the CHF there is an excess accumulation of fluids in the heart. To eliminate excess fluids from the heart, diuretics are the first choice. So there are different types of diuretics are there, like loop diuretics, thiazide diuretics. So different diuretics are there. So regarding diuretics, I discuss that in the classification of diuretics. I will discuss in the future. And next is bands VPC. Next is the letter S, sympathomimetic amines. So like examples like dopamine as well as a dobutamine. Dopamine as well as a dobutamine. Dopamine as well as dobutamine acts as a dopamine agonist. They act like a dopamine agonist. The dopamine agonist on the renal artery increases blood flow to the kidney and increases the glomerular filtration rate. If GFR increases, the excess fluid from the body eliminated to the kidney. So dopamine agonist, nothing but sympathomimetic amines, increases kidney function. If kidney function increases, there is an excess elimination of fluids from the body, and that decreases fluid accumulation in the heart and decreases congestive heart failure. And next is vasopressin receptor antagonist. Vasopressin receptor antagonist. Vasopressin, also known as ADH, antidiuretic hormone. So here, this hormone opposing the urination, antidiuretic hormone, preventing the urination. But in this condition, you have to promote the urination to eliminate excess fluids from the body out of the body. So from the body to the out of the body. So vasopressin receptor antagonist like tolvaptan, conivaptan. So TAN means antagonist. So these are the antagonist of vasopressin, VAP. So conivaptan. Tolvaptan selectively blocks vasopressin type 2 receptors. Conivaptan non-selectively blocks V1 as well as V2 receptors. And vasopressin is belongs to the G protein couple receptor. Nothing but vasopressin receptors are G protein couple receptor. And next is letter P, that is bands VPC. The letter is P, phosphodiesterase enzyme 3 inhibitor. Examples like ambrinon as well as milrinone. So both are inhibitors of phosphodiesterase enzyme 3. So this enzyme is present in the heart. This enzyme is present in the heart. Inhibition of this enzyme increase the cyclic AMP level, cyclic adenosine monophosphate. The increased cyclic AMP causes cardiac muscular contraction. So if heart is contracted, the fluid inside the heart comes out. And the same cyclic AMP on the blood vessels causes vasodilation. And generally, these phosphodiesterase enzyme 3 inhibitors are known as these are known as dilators, especially dilators. So simply they are called these are called as ionodilators. So they causes ionic contraction on the heart and dilation on the blood vessel. Ionodilator. So shows inotropic action on the heart, increasing contraction capacity of heart. When contraction capacity of heart increases, the excess fluids within the heart come outside, and same drugs doing dilation on the blood vessels. That's why called as ionodilators. And most probably commonly using drug is cardiac glycosides like digoxin as well as digoxin. And it is the cardiac glycosides are known as cardiotonics. So this is simply the classification of drugs for the treatment of congestive heart failure. So if you are preparing for a drug inspector and pharmacist exam, so contact me on 799-531-8103 because the notifications about drug inspector as well as pharmacist state-wise as well as central-wise, they are coming. They have the upcoming notifications are there. So please start before. Don't wait for the notification. And if you are really willing, contact me on the 799-531-8103. Thank you. Subscribe to our channel for more interesting videos and updates regarding pharma education. All the best.